Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Adderall and sex drive connection. Adderall is an effective treatment to increase focus and concentration in persons diagnosed with attention deficit hyperactivity disorder, ADHD. It can, however, reduce the patient's sexual urge. If you use Adderall, whether for ADHD or another reason, you must comprehend the medical information on the drug's potential adverse effects. While most side effects are beneficial when prescribed, substantial adverse side effects must also be considered. Dextroamphetamine and amphetamine are combined under the commercial name Adderall. Narcolepsy and attention deficit hyperactivity disorder are treated with it. Sleep disorder. It is a stimulant that can cause euphoria when taken inappropriately. It can be addictive, and Adderall side effects can be life-threatening in some cases. One should never assume a drug is safe to use in any quantity or conditions simply because it's prescribed. Recreational use of Adderall can quickly progress to addiction. Quitting the drug can be hellish and often leads to Adderall withdrawal symptoms. Recovery professionals recommend beginning the first phase of treatment in a supervised facility. This will start with undergoing medically assisted Adderall addiction treatment in an inpatient drug rehab. In addition, taking psychoactive drugs like Adderall and mixing them with alcohol poses a significant risk. Not only is mixing Adderall and alcohol terrible, but it's also deadly. Does Adderall affect sex drive? One adverse consequence of using Adderall is erectile dysfunction, ED. Some people report a lowered interest in sex and problem getting and keeping an erection. While some men claim that Adderall harms their sex drive, others say the opposite is true. It makes them more sexually motivated and prevents erectile dysfunction, ED. From person to person, this differs. Sometimes, stimulants like Adderall are used to treat the sexual side effects that some depression drugs may cause. Is it safe to combine Adderall and Viagra? Taking Adderall and Viagra, sildenafil, has no prominent side effects. Therefore, your doctor can prescribe both if you have ADHD and erectile dysfunction. Adderall may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Nervousness, headache, changes in sex drive or ability, painful menstrual cramps, dry mouth, constipation, diarrhea, nausea, weight loss. Some side effects can be severe. If you experience any symptoms listed in the important warning section, call your doctor immediately or get emergency medical treatment. Adderall libido problems. Both adults and children may be administered Adderall to treat the signs and symptoms of ADHD. It can be useful and beneficial but also have negative effects. Some of these side effects may include decreased libido and erectile dysfunction. People who experience Adderall erectile dysfunction may also have other sexual side effects, such as reduced interest in sex. Some people find that when they first start taking Adderall, their sex drive goes up, only to drop the longer they are on the medication. Women have been noted to experience decreased libido with Adderall. Other potential side effects, such as headaches, nervousness, and more painful periods, can also reduce a person's sex drive. When a person experiences Adderall erectile dysfunction, ED, it also affects their sexual partners. Talking with your partners about how your medication contributes to ED is important. You might want to explore non-penetrative sexual activities together. Adderall side effects in females. Adderall side effects in females are often cited in terms of how weight and estrogen impact the drug's effectiveness. The Food and Drug Administration, FDA, reveals that improper dosage can significantly increase processed amphetamine in females. However, by adjusting the dose based on weight, this difference disappears for both men and women. But there's more. Estrogen, the powerful hormone, emerges as a key player in the effectiveness of Adderall for women. During heightened estrogen levels, such as puberty, pregnancy, menopause, and ovulation, women have reported experiencing an intense high after taking Adderall. This heightened experience can trigger addictive behaviors and physical dependency, as these prescription medications mimic naturally occurring substances in the body. Continue reading to uncover the fascinating science behind Adderall's impact on women's health. Adderall erection. Regardless of whether Adderall libido is part of your routine, it can impact your life. And that includes your sex life. Touch is soothing to people, so medical trauma doctors, psychologists, and many other physicians advise diagnosis or treatment with physical touch to help heal those injured and mend relationship problems. When you are on Adderall, the positive effects of touch normally intensify, especially when you are doing a sex act. Without a doubt, this drug helps your brain stay focused on a lot of things, and one of those things could be sex. Simply put, it has the potential to make you hornier. People who find this drug positively impacts their sex life think about sex more throughout the day. They also tend to do things outside the norm that would help facilitate sexual encounters, such as consuming aphrodisiac foods. Some report that they crave black licorice and make it a point to wear sexy lingerie and garments. Another bonus of these meds is less need for lubrication, which no one likes to fuss with when things get hot. Adderall and sex drive. What to do about the sexual side effects of Adderall? While you might feel embarrassed or shy to talk to your doctor, you must tell them about any erectile dysfunction symptoms you might have. Your doctor will understand that erectile dysfunction is a possible side effect of Adderall libido, and they will want to help you fix the issue. Your doctor might suggest one of the following answers. Erectile dysfunction caused by Adderall. Adderall is known to constrict the blood vessels in the body, including those in the penis. As a result, this blood flow reduction may lead to erectile dysfunction in some users. What is erectile dysfunction? Whether due to taking Adderall or other causes, erectile dysfunction is defined as difficulty achieving or maintaining an erection. For the most part, erectile dysfunction is related to issues with the cardiovascular system. Since erections rely on the sufficient and steady flow of blood to the male sex organ, anything that hurts blood flow can lead to erectile dysfunction. The most common examples are various heart conditions, high blood pressure, and complications from diabetes. Along with these physical causes, erectile dysfunction can also result from anxiety, stress, or depression. Sex addiction and Adderall. Adderall and sex drive addiction affect millions of adult men and women in the United States. It is not officially recognized as a mental illness by the American Psychiatric Association. However, many individual psychiatrists and therapists treat it as a disorder because it still causes many problems for those who are addicted and their families. Like other addictions, sex addiction can cause people to engage in risky and thrill-seeking behaviors. In this case, people with sex addictions frequently engage in unsafe sexual practices. They are also more likely to misuse drugs like Adderall. Adderall misuse and sex addiction can have serious consequences, and both should be treated accordingly. Among other effects, amphetamines increase risk-taking behaviors among people who use them in larger quantities. This includes sexual risks, such as hiring a prostitute, having multiple sexual partners, or having unprotected sexual intercourse. People with sex addiction are likelier to engage in risky sexual behaviors. Adderall addiction treatment options. Many options are available to help the person stop taking Adderall and avoid serious side effects from substance abuse. Many Adderall users respond well to residential rehab programs. If you are experiencing Adderall addiction, getting an accurate assessment of all the symptoms is crucial. When a mental health professional has evaluated the symptoms, it may be determined that another form of mental condition is present and needs a particular treatment. This approach simultaneously addresses mental disease and the substance abuse issue. Long-term recovery will mostly depend on whether both diseases are treated by the same team or provider, regardless of whether the diagnosis, mental health problem or substance addiction problem, was made initially. During your rehab, the staff from your treatment facility will help you identify what caused your addiction and teach you skills that will help you change your behavior patterns and challenge the negative thoughts that led to your addiction. Sometimes, the pressures and problems in your life make you rely on substances to help you forget about them momentarily. Contact one of our helpful treatment specialists today if you or a loved one are struggling with long-term drug abuse and a co-occurring mental health condition such as depression. We Level Up can provide information on dual diagnosis treatment and detox programs that may fit your needs. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.